You are taking your medication every day, you are watching your salt intake, you are doing what your doctor told you to do, and yet your blood pressure numbers are still not where they need to be, or they are controlled but barely, and the thought of what happens if they creep up again sits quietly in the back of your mind. What I want to share with you today is not a replacement for what your physician has prescribed. It is something that should have been part of that conversation from the beginning, and in most 15-minute appointments, it simply never comes up. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health. Simplified and designed for adults over 60, stay with me through this entire video, because by the end you will have 5 specific, evidence-based, kitchen-based strategies that work alongside your existing medication to address the underlying biological mechanisms driving blood pressure after 60. Let's start with what your doctor often does not have time to explain clearly. After 60, blood pressure does not rise simply because of stress or sodium. Something deeper is occurring in the structure of your blood vessels. Think of your arteries the way you would think of a garden hose. When new and flexible, it absorbs pressure and handles flow without effort. With age, the walls of your blood vessels stiffen, they lose their elasticity. A rigid vessel cannot manage the same pressure a flexible one can. That structural stiffening is driven primarily by one process: chronic low-grade inflammation, not the visible inflammation of a swollen joint or an infected wound, the slow, invisible, silent kind that smolders in the walls of your blood vessels year after year without producing any obvious symptom. Day after day, it quietly narrows and hardens those vessels. Your heart has to generate more force to push blood through, pressure rises, and here is what connects this directly to your kitchen. What you eat 3 times a day is either feeding that inflammation or working against it. Every meal is a decision your cardiovascular system registers at the cellular level. Most patients are never told this, not because their physicians do not know, but because there is no time to explain it in a standard appointment. A study published in the Journal of Nutrition found that one specific dietary intervention, daily hibiscus tea consumption, reduced systolic blood pressure by an average of 7 points in adults with mildly elevated pressure. 7 points from a tea, that is a clinically significant reduction. The kind of number that would be considered meaningful in a pharmaceutical trial. That is the magnitude of impact that targeted dietary changes can produce when they address the actual mechanism rather than simply managing the symptom. Let me now walk you through the 4 main biological mechanisms driving blood pressure after 60, and the 5 specific strategies the evidence supports for addressing them. The first mechanism is post-meal blood sugar spikes and vascular constriction. Every time blood sugar rises sharply after a meal, your body releases a surge of insulin. That insulin surge causes your blood vessels to constrict, tightening in a way that raises blood pressure directly. This happens at the dinner table, after every meal, multiple times per day, and most people have no awareness of it. The simplest, most consistently effective intervention for this requires no new food, no supplements, and no cost. It requires only a change in the sequence of what you eat. Begin every meal by eating your vegetables completely before touching anything else on the plate. The fiber in those vegetables forms a physical barrier in the stomach that dramatically slows the rate at which sugars from the rest of the meal enter your bloodstream. The blood sugar curve flattens, the insulin surge diminishes, the vascular constriction is reduced. I had a patient I will call Gerard. He was 71, had been managing hypertension for 6 years on 2 medications, and his post-meal blood pressure readings were consistently elevated. We changed nothing about his diet except the order: vegetables first, protein second, carbohydrates last. At every meal without exception. At his 4-week review his post-meal readings had dropped noticeably. His physician noted the improvement and asked what had changed. The answer was the sequence of his fork. The second mechanism is impaired nitric oxide production. Nitric oxide is your body's natural vasodilator. It tells your arterial smooth muscle to relax and open. When nitric oxide production is adequate, vessels stay flexible and pressure stays manageable. When it is impaired, vessels constrict and stiffen. Acetic acid, the active compound in apple cider vinegar, has 2 documented effects on this mechanism. First, it improves insulin sensitivity, reducing the post-meal insulin surge that constricts vessels. Second, and this is what made researchers take notice, It directly stimulates nitric oxide production in blood vessel walls. The effect is chemically similar to a class of medications called vasodilators, available naturally for a cost of a few euros per bottle, 1 to 2 tablespoons diluted in a full glass of water with each main meal, 3 times daily. The dilution is not optional. Undiluted acetic acid can damage tooth enamel and irritate the esophagus, always in water, ideally through a straw, and if you have a history of stomach ulcers or significant acid reflux, discuss this with your physician before beginning. The third mechanism is nocturnal hypertension. Most people check their blood pressure in the morning and regard an acceptable reading as reassurance that everything is under control at night, but in a condition called nocturnal hypertension, which is significantly underdiagnosed in adults over 60, blood pressure does not drop during sleep as it should. In some people it actually rises. While you are lying completely still and unaware, your cardiovascular system is under sustained pressure. This pattern is associated with a substantially higher risk of stroke and cardiac events than daytime hypertension of equivalent magnitude, because the arterial walls receive no overnight recovery period. Walnuts consumed approximately 30 minutes before sleep address this mechanism through 3 simultaneous pathways. They are one of the richest plant sources of alpha-linolenic acid, a plant-based omega-3 fatty acid that reduces vascular inflammation. They contain melatonin, which supports the natural circadian regulation of blood pressure, and they contain L-arginine, a precursor to nitric oxide that supports arterial relaxation during the night hours. 30 grams, approximately 14 halves, 30 minutes before bed. Multiple clinical studies have documented meaningful reductions in nighttime blood pressure from this specific habit. The fourth mechanism is systemic inflammation driven by oxidized cooking oils. Most people do not realize that the oils they cook with every day are one of the primary dietary contributors to the chronic vascular inflammation described at the beginning of this video. Refined seed oils including canola, soybean, sunflower, and corn oil are extremely high in omega-6 fatty acids. In appropriate balance with omega-3, omega-6 is not harmful, but the modern dietary pattern typically delivers 15 to 20 times more omega-6 than omega-3. That extreme imbalance is one of the principal dietary drivers of chronic systemic inflammation. Additionally, these oils are chemically unstable under heat. When brought to cooking temperature, they oxidize and release compounds called aldehydes, which are directly toxic to blood vessel walls. The damage is invisible and tasteless, but it accumulates with every meal prepared in these oils over months and years, replacing refined seed oils with extra virgin olive oil for all light heat cooking and dressings, and with real butter for higher heat applications, removes this daily inflammatory input and replaces it with compounds that actively support vascular health. Extra virgin olive oil contains oleocanthal, a natural anti-inflammatory compound that inhibits the same inflammatory enzymes targeted by ibuprofen. Decades of research support its cardiovascular benefit without serious scientific debate. Before I give you the complete action plan, I need to say something clearly and without softening it. Do not stop, reduce, or modify any blood pressure medication your physician has prescribed based on anything in this video. These 5 strategies are designed to work alongside medication, not to replace it. Some of them, specifically the hibiscus tea and apple cider vinegar, have mechanisms that overlap with certain medications, and combining them without your physician's knowledge can push blood pressure lower than intended. That is not the goal. The goal is additive benefit under medical supervision, not self-adjustment. Bring this information to your next appointment. Have the conversation. Your physician is your partner in this, not an obstacle to work around. Now, what does the evidence support as the complete 5-strategy protocol? The 5th strategy, which completes the approach, is hibiscus tea consumed 3 times daily, hot or cold, with minimal added sugar, as described at the beginning of this video. Hibiscus contains anthocyanins and organic acids that act on blood vessels through a mechanism similar to ACE inhibitor medications, one of the most widely prescribed drug classes for hypertension. The study published in the Journal of Nutrition documenting an average 7-point reduction in systolic pressure used this specific dosing pattern. If you are currently taking an ACE inhibitor, discuss the addition of regular hibiscus tea with your physician before beginning. The combined effect can be additive, which requires clinical awareness and possible dose monitoring. For those not on ACE inhibitors, this is one of the most accessible and palatable additions available. I want to tell you about a patient I will call Bernard. He was 67, had undergone cardiac surgery and come through it well, and at his 6-month follow-up had implemented all 5 strategies in collaboration with his cardiologist. His physician reduced his blood pressure medication from 4 to 2, his inflammatory markers had dropped significantly, his pressure was stable in a way it had not been for years, he described feeling more like himself than he had in a long time. None of the 5 things he did required a prescription, all of them required only his kitchen and a conversation with his physician. Here is exactly what to do. Step 1. Beginning at your very next meal, eat every vegetable on your plate completely before touching bread, rice, potato, or any other starchy carbohydrate. Do this at every meal from today forward. Step 2. Introduce 1 to 2 tablespoons of apple cider vinegar diluted in a full glass of water with your main meals. Begin with 1 meal daily for the first week to assess tolerance, and progress to 3 times daily if no discomfort occurs. Step 3. Eat approximately 30 grams of raw unsalted walnuts, roughly 14 halves, 30 minutes before sleep. Beginning tonight. Step 4. Open your kitchen cupboard and read the label. On every oil you currently use, if it contains canola, soybean, sunflower, or corn oil, stop purchasing it when it runs out and replace it with extra virgin olive oil as your primary cooking fat. Step 5. At your next physician appointment, bring up each of these 5 strategies specifically and ask your physician whether any of them might interact with your current medication regimen, particularly hibiscus tea if you are on ACE inhibitors. And ask whether your physician would be willing to monitor your inflammatory markers alongside your blood pressure over the next 3 to 6 months so that you have objective data to evaluate the response. One important clarification before we close: the 5 strategies described in this video are most applicable to adults with mild to moderate hypertension who are already under physician supervision and looking for evidence-based dietary tools to complement their treatment. They are not an appropriate primary intervention for severely elevated blood pressure, hypertensive crisis, or any acute cardiovascular presentation. If your blood pressure is severely elevated and you are experiencing symptoms including headache, visual disturbance, chest pain, or shortness of breath, contact your physician or emergency services rather than adjusting your dietary habits. Additionally, the benefits described here are most meaningful when applied consistently over weeks and months. These are not acute interventions. They are daily habits that shift the underlying biology gradually, expecting dramatic change within 48 hours will lead to premature abandonment. The patients who see the most significant benefit are those who implement all 5 consistently and track their results objectively. Your blood vessels are genuinely responsive to the right conditions. After decades in clinical medicine, what strikes me most is not how difficult it is to support cardiovascular health. It is how straightforward the biology is once you understand what it actually needs. 5 strategies, all pointing toward the same underlying mechanism: less inflammation, more flexible vessels, more stable pressure. If this video gave you something useful, hit the like button right now, leave a comment telling me which of these 5 strategies you plan to begin tonight and which one surprised you most, and share this with someone you care about who is managing blood pressure and has never been told that their kitchen might be the most important room in their healthcare. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.